now is to get these institutions speak to each other, design very targeted and specific programs, share budgets, and include women at the decision-making space.
Mm-hmm. Let's hear now from Elizabeth.
We also reorganize. I'm looking at
just a second, Dr. Kimemia. Let's hear now from Elizabeth Njoki, because she, has the experience from the ground. She has been as a bus terminus manager and a conductor for the last 10 years. Elizabeth, thank you for joining us on this forum today. How has life been since COVID-19 as a professional woman in the public transport sector?
Life since COVID-19 has been very difficult because so many things changed. Immediately when it was announced that we are going not to carry the capacity that we used to, our salary declined, whereby we could manage to cater for our families. You can consider getting a salary of 1,000, then you come and get of 200 shillings. It affected us a lot, and we had to change with life, of which it was not easy, because even some of the counties, you couldn't travel to go to your up countries, maybe take your kids there. You get some of us, the house was closed, so you could look for a place to take your kids and look for some time to go and sort out your issues. And the worst side of it was that even the commuters were not taking it seriously, because some of them, you could tell them to use sanitizer and they could tell you, hakuna COVID, hiyo ni kudanganywa, tunadanganywa. And others will even insist that they want to sit with their partners. And when you tell them they are supposed to keep that social distance, some will tell you, huwa hatuweki social distance kwa bedroom. So it was hard for us to explain to them. But with time, we have been trying to be strict on them.
Let's talk about life in general, because according to this survey by Flown Initiative, about 68% of women who work in the public transport sector work about 6 days a week. Some work 7 days a week. 85% of them are conductors. Majority of them are single women with children. And without schools, children have been forced to stay home without pay. Many of these women in the public transport sector cannot afford people to take care of their children. So how has life been for a majority of these mothers working professionally in the public transport sector?
Yeah, it hasn't been so easy, because some of us are forced to talk to our neighbors so that you could leave the kids with them, of which you are not sure of their security. And because we had to tell maybe the house help that we cannot go ahead with them because we cannot afford to pay them. So we were trying to minimize even the budget. So, and others were forced to take their kids to their parents in the rural area. And most of us were outside, jobless, and we had to share. If at all we are attending, we are working for 6 days, some of us were forced to work for 2 days, and most of them lost their jobs until now. Now what we used to do, they will come, and those who are on duty will try to give them something little, like 20 shillings, 30 bob, and someone gets in the evening, you have 200 to 300 shillings per day.
And I understand several issues, Elizabeth, like your male counterparts asking for sexual favors from those who are going to ask for help, of course, in terms of money and food. What recommendations would you, as a woman in public transport, make to policy and stakeholders, to have a sustainable public transport system, even for those who work in it?
I would suggest the best way is to make this job formal, so that we can have job security, in that when you're employed, you have some salary, because most of us have given in to men because we want to secure the job.
All right. Dr. Kimemia, let me come back to you. I mean, having heard from Elizabeth and from the experience, which is really what is, has been outlined in the Flown Initiative survey, how can we mitigate the impact of COVID-19 on women working in the matatu industry?
There's a global call for adaptability, and I'm impressed with just how the women have been able to leverage on the few opportunities that come their way in the wake of the COVID. It's unfortunate that many have experienced gender-based violence, and what I think is most practical is to look at the whole sector holistically, and also connect, or at least undertake a multi-sectoral socio-economic agenda or a program where the public transport, public health, water and sanitation speak to each other. And also the issue of trade. If we can have like organized vending along the bus parks and along the pathways, if we can have the government invest in non-motorized transport, if we can have the government invest in sustainable sanitation facilities like toilets along the path to the bus parks, or what is generally referred to as the last mile. If very specific initiatives are put in place, then a lot of capacity building for these stakeholders, because as it is now, there's a recommendation of cashless, so there has to be investment in training and skill building. So in that way, then we will see a value chain approach in socio-economic empowerment of this particular space, and the women will be able to earn incomes not necessarily from collecting fares, but from other related businesses that are within the space, the public space. This is something that can be achieved by leveraging on the resilience programs that are there. And I like what the president has said. If this particular sector can be represented in the new committee that has been proposed, then it's possible that there will be other opportunities of earning an income.
All right. Naomi, let's come to you. It's clear that we will have to live with COVID-19 for quite a while. From your survey, 14% of the women in public transport expressed a general fear of police brutality after the curfew, for the main reason that many of them do not live along the routes that the matatus they work in operate as well. Now, I mean, how do we move forward to this? Because the curfew, again, has been extended from the 9 p.m. to 4 a.m. curfew has been extended. So these women will continue working under those situations. Do we classify this as essential services? What is the way forward here?
Yes, definitely we should classify public transport workers as essential workers providing an essential public service. And in addition, we've also had incidences where our women have already experienced police brutality after being caught outside during curfew hours. And one of them, for example, had to give her daily wage and go home empty-handed in order for the police to release her. And so I think to your point that, yes, we are definitely advocating for public transport workers to be seen as essential workers. And in addition, I would like to maybe point out some other recommendations we've made out to various stakeholders. And one of them includes, I think you've touched upon, that enforcement of the Employment Act, right? And that will enable the workers to actually have a contract and move from being informal into the formal positions, and also to create clear career pathways for women getting into the industry, because right now there is a gap that is enabling former colleagues to ask for sexual favors in exchange for work. If there was a desk that you go to, right, and formally get recruited into the matatu industry, it would be easier to follow up these cases. But for right now, the women are at the mercy of, for example, even the drivers, the stage managers, and it makes it even harder to go report the incidences.
All right.
In addition, the Kenyan government. Sorry, Michelle?
Go ahead.
I was going to say, in addition, the Kenyan government has ratified the ILO recommendation, which is the International Labour Organization, which talks about how to move, for example, public transport industry workers from the informal to the formal industry. So we already have the policies in place. What is lacking is just the enforcement.
Right. And I mean, even as we await that enforcement, because the major recommendation here has been to formalize this sector, ensure that, the women in transport and public transport sector have contracts to sign before they work here. But at the end of the day, Naomi, this is the reason why you began this Flown initiative. Having more women working professionally in the public service sector makes it safer for women in general to use public transport in the country. Now, with the COVID-19 pandemic, there's less women in the public transport sector. Many have had to seek alternative jobs to provide for their children and their families. So what gap does this leave in terms of safety of women accessing public service vehicles? Because we have had issues of sexual abuse before.
That's a really good question. So women actually make majority of public transport users, not just in Kenya, but around the world. Women have less ability to afford personal means of transport. I think growing up, we had this example where you're like, gari ya daddy, right, before you get to gari ya mami. And I think one of our mission as women in transport is to attract, retain and advance women professionals in the industry. And we've been doing a lot of retaining because the turnover is high, because for lack of a better word, the public transport industry has been a toxic work environment for women. And so by advocating for formality, I think it will encourage more women to get in, but also put at ease the women commuters who make majority of public transport users. I would also like to take this opportunity to address one of the concerns that because of social distancing, that challenges faced by female commuters has decreased. But that is not true, because a commute has about 3 stages, right? There's a stage where you are walking from home or traveling from home to the stage. When you're at the stage, waiting for the matatu, when you're getting into the matatu, when you're inside the matatu, and then the process continues where you drop off the matatu, you're at the stage and you're heading to your destination. And all these commute stages have different form of harassment. So, and we found that most form of harassment, and that is indecent touching and verbal insults, actually happen at the stage when a woman is waiting for the matatu or the public transport vehicle. And so you'll see that even during COVID, that women are still experiencing challenges when trying to access public transport. And this calls for continued advocacy, right, in the public transport industry to make the industry safer for both women commuters and professionals.
All right, Elizabeth, let's hear from you in matters of sexual exploitation, sexual harassment in your workplace. I mean, women passengers face a lot of trouble using public transport. You can only imagine what the situation is as a woman professional in the industry. What has your experience been?
For now, it's very difficult because most of us are at home, and you'll get the ones who are on duty cannot handle some of them, and the harassment is high because at least for when there's that gap on the seats. So we'll get the sexual harassment is still on, and it has even arisen.
Dr. Kimemia, let's speak a bit more about this as well, because Elizabeth earlier on mentioned the fact that even as the government issued the COVID-19 prevention guidelines for the transport sector, which include using hand sanitizers, wearing of PSV masks while on board, a lot of passengers do not abide by these guidelines. And so they expose those working the public transport sector. How can we further remedy this? Because you've sat on several boards. You've headed the transport sector in Kiambu County in itself. How can we ensure that these regulations are followed?
The public space is quite interesting because, like when the health protocols were enforced, there was a combination of fear, which caused many people to enforce. I mean, to comply with the requirement. But with time, we have seen a lot of laxity, and now that boils to the problem of having weak enforcement mechanisms and personal responsibility. Mm-hmm. So capacity building, continuous sensitization is important, but I also think that within these public spaces, there is need for institutions that will be charged with the safety, particularly the safety of women. Mm-hmm. Mm-hmm. Like we have the National Gender-Based Violence Hotline. But even if a case is reported, there is very little response or prevention that is realized because of lack of institutional mechanisms to deal with the issues of response and issues of prevention. So like what the president has said, we need to start, we need to go back to factory settings. Mm-hmm. And what I can say is the agenda right now. Of course, all of us are aware of the president's agenda for introduction of the mass rapid transport system, where we will have the light commuter rails, and we'll also have the bus rapid transport systems. Mm-hmm. Mm-hmm. And I actually want to take this opportunity to congratulate the president for appointing a chairman for NAMATA, because that is one institution that is going to see a lot of these issues we are having sorted out. Mm-hmm, mm-hmm. Once that agenda is implemented, there is going to be a lot of formalization of the employment opportunities that are available there. There's going to be a lot of capacity building. There's going to be a compulsory cashless system for boarding. There's going to be greater linkages between the mass rapid transport system and the ordinary system. You know, there's a lot of investment that has been put in place to ensure that the public transport space is formalized, it is safe, it is convenient, and of course the issues of climate change is addressed.
All right.
So I can
the
foresee
problem, Dr. Kimemia, has been that as much as all these policies are in place on paper and they look very good, what has been the problem in implementing them? Because like Naomi says, we have documents, even the International Labour Organization, we have contracts that these public transport workers could sign, but why has it not been implemented?
I think it's a multi-dimensional issue. Like I have said, the public transport right now is domiciled in 3 state departments. So that in itself creates an awkwardness in terms of shared responsibility, shared budgets, shared mandate, shared approach, different people having different interests, and at the end of the day, the public space is the one that suffers. So there is need for policy dialogue, and there is need for greater involvement of other stakeholders, and even the decisions on the mandates of the policy departments or whoever is responsible. Because like now, NTSA has a clear mandate that is totally different from NAMATA, yet all of them are addressing public transport. Yeah, so it is both a creation of the system and lack of involvement of the members of the public, and also lack of commitment on the part of both government and the members of the public to the basics that are contained in the Constitution. So we all need a culture change. And like the President has said, we need to reorganize ourselves, our thinking, and I'm sure we will be able to achieve much.
Right. Naomi, let me come to you in terms of the recommendations that have been given, especially in that survey by Flown Initiative. But like, every other time, we have these documents, we have these surveys, we have the recommendations, but getting the stakeholders to sit down and implement these recommendations becomes a problem. So where do we go from here after this survey?
So one of the recommendations we've made, and the reason why we had a public forum during the morning session, was to bring together various stakeholders and speak to them about their responsibility and the recommendations we've made in the report. And so in the morning's forum, we had representation from the Council of Governors, the Office of Excellency Women Representative of Nairobi, various labor unions, and county officials and NTSA, and we had a discussion about the recommendations we made, and we will be sure to follow up with them. In addition, we had discussions with trade unions who are tasked with the mandate to lobby and advocate for the workers' interests, and they were quite keen to do so. And so I believe that we all have contribution to make towards holding the government accountable, but also doing our best as individuals. As Flown, we will continue to collectively lobby for the interest of our women, but this is not the end of it. This is an ongoing project, and we will follow up with various stakeholders.
All right, and even as that following up happens, I mean, these women still have to work in this sector every day. Elizabeth, let's come to you. One more time. According to this survey, even as you work in this job, there's no access to clean water for hand washing. Access to hand sanitizers, according to this survey, has been a big problem as well for those working in the public transport sector. So what can be done now, immediately, to make life easier for women in this sector? Elizabeth.
As before, we were helped by Flown, because Flown was providing us with face masks and sanitizers. Now what I would advise, I'll just say, we would appreciate even more if the government would give us that clean water to wash our hands, and also provide for us sanitizers, because we'll get some of the stages. We have the tanks for washing our hands, but there are some places that they don't have the water, and we don't also have the access to the sanitizer.
All right. Dr. Kimeme, your final comments on this, even as we wind up on the conversation. So we have the recommendations. We're talking about formalization of the public transport sector. You mentioned so many documents that have been put in place. But again, what did you see different in Kiambu County that we can emulate in the Nairobi metropolitan area and other regions in the country?
I think the COVID context has brought with it a new type of thinking because we've seen a lot of investment in non-motorized transport systems. So to me, what I would like to see is the infrastructure improved to become more people-centered, organized street vending, where the metropolitan counties or the urban centers facilitate traders to trade along the corridor. I would like to see every bus park have toilets, and toilets that are inclusive, which can be used by persons with disability, can serve the interests of women. You know, women have more peculiar needs than men. What I would like to see also is like daycare facilities within the bus park areas, so that these women can be able to take care of their children as they do their work, particularly those who work as touts, or they work as stage managers, or those who are actually the conductors. A lot of training is important. Of course, we have to go digital. That is one of the dictates of COVID. Mm-hmm. So investment in training and just national budgets and county budgets working towards making life easy for people. Mm-hmm. So sustainable urban mobility plans must be put in place, must be budgeted, and there has to be capacity of those who work in the space, whether they are government employees or other stakeholders. The government has to really up the game and be more people-centered and very basic, like water, running clean water. It should be a must in every passage, in every bus park.
All right. Naomi, let's have your final comments as well. As the founder of Flown Initiative, a women-led organization working towards a safe, sustainable space for women in public transport, what do we expect from Flown Initiative in coming days? Naomi, can you hear me? All right, we seem to have lost contact there with Naomi Maura. She is the founder of Flown Initiative, but that is a special conversation on the impact of COVID-19 on women professionals in the